Good evening and welcome to the Cancer Education Series, brought to you by Mercy One and Above and Beyond Cancer. We are funded through a grant from the Iowa Cancer Consortium. My name is Chris Goodale and I'm the Executive Director of Above and Beyond Cancer. And it is my weekly pleasure to introduce the founder of our organization, Dr. Richard Deming, who will introduce our speaker for this evening. Dr. Deming?
Great. Thank you, Chris, and thank you everyone for attending. You're in for a treat. Dr. Marla Shapiro is our presenter, and Marla and I met about 6 months ago. She'll tell you a little bit more about her extended history. She grew up in the South, went to grade school and high school in North Carolina, and then went to Mr. Jefferson's University, the University of Virginia, for her undergrad work, and then got her PhD at Georgia State. She is a neuropsychologist. And if you don't know what a neuropsychologist is, you're not alone. I'm sure she spends much of her time explaining what that is. So let me just explain a little to you all in my simple understanding. You know, we used to separate the brain from the body, and we think that just what happens in the brain was the brain, and what happened in the body was physiology that we studied. Well, there is such a connection between our thoughts and what happened in the brain and what happens in the rest of the body. And not only do cancer patients and survivors benefit from knowing about neuropsychology, but pretty much being a human being can benefit by knowing about the relationship and what happens with neuropsychology. So with that as an introduction, Dr. Shapiro also wants you to know you can interrupt at any time with a question while she's presenting. You can either do that, well, if you're one of our audience, you'll have to do it with the chat, and we'll be looking at the chat. And then after Dr. Shapiro's presentation, she and I are going to have a bit of a conversation. But I am going to turn my video off and turn it over to Dr. Marla Shapiro.
Well, thank you. And let me make sure, Dr. Deming, Chris, you can see my slide and not my cheat notes. Yes?
We don't see the slide. We do see this next slide and your notes. So if you go
How about that?
Let's see. No, we're still seeing both.
Okay. You know, we had this figured out before.
I know. If you go to share your screen and instead of the presenter view, go up to the top where it says slideshow. So go back to share your screen.
You know,
Marla.
I have to figure out which version I was sharing with y'all.
Oh, okay.
Maybe it was this one. How about now?
There we go. And then at the top where it says slideshow.
You know, we practiced this how many times? And you're recording it now. Because that was also wrong. So I have here, share.
Okay.
And what are you seeing?
And yep.
And now
up at the top, it says slideshow. If you click that.
Yep.
And then way to the left from beginning. Go to the left. Yep.
Okay.
There you go.
And what are you seeing? The slide?
Oh, no, we're still seeing the second slide as well.
How about now?
There we go. Perfect.
Okay. So I had it right the first time. Okay. Only took us 13 seconds, but thank you. And, you know, for whatever it's worth, Dr. Deming, if you ever want to quit your day job and work in a marketing capacity for neuropsychologists, I think you have a bright future. So I appreciate the introduction. And yes, I'm happy to talk about what neuropsychology is. And when I was thinking about what I could say that would be useful, you know, you're very welcome opportunity to talk about what is neuropsychology. I thought what better way than to kind of talk about how I got to where I'm doing, because I think it'll help inform what it is I do and why I think it actually matters or could be helpful. And so I, went to college, grew up in the South. When I graduated college a few decades ago, I really did not want to go to any more school. But so I worked in retail, I worked in business, I was a headhunter, I placed engineers, but I missed working with kids and had an opportunity to volunteer at a camp one summer as a lifeguard. yeah, they had cancer, but that really wasn't the thing that drew me. It was kids, summer camp, whatever. And so at 25, 6, I'm not going to do the math, but in 1988, I spent my first week at a summer camp for kids with cancer in Atlanta called Camp Sunshine. And I had a blast. And in talking to these kids just about life, I'm like, yeah, well, yeah, I guess school's tough, but let me get this straight. You had cancer in your brain. You had chemotherapy strong enough to kill cancer, and people want to know why you're struggling in math. Like, that made no sense to me. And so in talking to the kids, because if you're under 40 at this point, you're a kid to me, talking to our kids, there was a lot of stuff they needed help with. So I thought about growing up to be a psychologist. So maybe I was going to go back to school, be a psychologist, be a therapist, and save the poor sick kids, as they call themselves. And so I took my first graduate school class, and yeah, counseling sounded cool. Then I learned about school psychology and testing, and that you don't just counsel people, you figure out what's wrong and tell everyone else what to do about it. And that sounded very cool to me. So kind of switched my trajectory into school psychology. Psychologists, we do lots of testing, and we learn to give this test for this and this test for that. And we were told this test measures whatever. And I would say, but why? How do we know it measures that test? How do we know? And it wasn't until I learned about the brain and what our brain controls, and especially the relationship between our brains and behavior, that things started to make sense to me. And neuropsychology is just that. It is the study of brain behavior relationships. And so for me, learning that perspective and putting mind body stuff together is what really got me on the career path I'm on today. And you can see, I've stayed involved with Camp Sunshine. My beloved offspring, who just loves that I show her off in slideshows, has been involved ever from the beginning. And 2018, she was working at the same camp facility as a counselor. And so it has been part of my personal life. It's been absolutely shaped the trajectory of my professional life. And that perspective is important, I think, because knowing about cancer and recreation and what matters in life was really what got me started, where I am today. So, I talk about neuropsychology, not just, what we can do in a very traditional sense, and how this brain behavior stuff matters with respect to testing, which is what most of us do, but also, as Dr. Deming, said, in a much broader way about the brain, mind, and body, because they are absolutely symbiotic. They are interchangeable, one and the same. And please, I know we have time for questions and conversation at the end, but I hate listening to myself talk this long without interruption. So if you have questions, put them in the chat, raise your hand, and Chris, I know, will jump in and interrupt me, because I would much rather make it more interactive if you like. So at any rate, neuropsychology, brain behavior relationships. In the olden days, before we had CAT scans and MRIs, neuropsychs would use testing to decide is there damage or not. What is the likelihood of there being brain damage based on how somebody performs on various paper and pencil tests? Well, now we have better stuff like CAT scans and MRIs and PET scans and so forth. And so over time, the role of a traditional neuropsychologist in testing has been not just to say is there brain damage or not, but what are the functional effects of some sort of disease or injury or process. So for example, with respect to persons who are undergoing treatment, whether it's cranial radiation, chemotherapy, whatever, what are some of the short-term effects? What about chemo brain? I've had kids say, I don't know why I didn't pass my placement test. Well, sure, they were getting massive doses of methotrexate or something that was affecting reaction time or memory. That's going to come sometimes with some short-term effects that some testing can clarify. We can make recommendations for workplace, school, whatever. Sometimes we have longer term or late effects, things that can affect our memory, attention, anything that our brain controls, really, and especially for brains that are still growing and maturing. We may not see some of the late effects for some time past treatment. So that is what neuropsychs can do in a very traditional sense. When we do testing, it can be very comprehensive. It can be very skill specific. I've had folks say, my memory really sucks, and maybe they're still undergoing treatment, so I don't need to spend hours and hours of testing, but I can do a little structured stuff with them and say, yeah, compared to where I think you should be or used to be, this seems to be an issue, and then offer some very specific tips for that. We can look at post treatment effects. I've had lots of folks that say, I had one patient I saw in Atlanta who was a junior in high school, had a very unusual, actually benign brain tumor. And they went up through brainstem. And the surgeons are like, you're great, you're fine. Well, yeah, because she could walk and talk and feed herself and seemed okay. But knowing where the surgical path was and how it affected reaction time and some other things, fine to the neurosurgeon wasn't quite fine to me. And so for me, testing is all about what's your problem? How can I come up with strategies to fix, to help, to overcome? So whether it's rehab areas or accommodations, and of course, that interaction with whatever was there before with respect to pre-diagnosis or pre-treatment factors. So that's a traditional role of a neuropsychologist in general, and also in working with any kind of patient group. But for me, the exciting part is not just that we're tied to tests, that its fundamental core, a neuropsychologist focuses on brain behavior relationships. And so that's really what I want to spend some time talking about tonight too. Of course, I'll answer questions about testing, but things don't have to actually touch the brain directly to affect how we're functioning, because everything that we do is regulated by the brain in some way. Some of it is very intentional. The fact that I want to choose to focus on the camera versus, oh, I don't know, my closed window or whatever. That's intentional. Some of the control, some of what our brain controls is automatic. I don't usually have to remind myself to breathe. Sometimes when I'm nervous, maybe, but everything we do is controlled by the brain, and none of it occurs in a vacuum necessarily. And to me, a prime example of this is stress. And when I talk about stress, I really refer to any kind of stress on our system, whether it's the, oh my gosh, I'm stressed, I'm worried how I'm paying my bills kind of stress, or anything that demands energy or puts pressure or takes resources on our body. So stress can be physical pain, stress can be worry, stress can be mood. It's anything that kind of sucks our energy out in some way. It is a very physical response. For anyone that's taken a basic psychology class in high school or college, you learn about your fight or flight response. It's nature's way of helping us just instinctively defend ourselves against any sort of threat or danger. If we see danger, whether it's a nurse with a really big needle, or it's a wolf, or a car driving the wrong way, whatever, our body's like, danger, danger, danger. And there are automatic parts of our brain that kick in. It actually releases various chemicals, adrenaline, that adrenaline rush you hear about, cortisol, and those biochemicals controlled, released by our brain, activate various body systems to prepare to do battle, if that makes sense. So our muscles tighten, our heart rate increases, our heart's going to beat faster. It's fight or flight because we're shifting our resources to fight off a life threat or to flee an enemy. I mean, it'd be nice if we could run from cancer. It's not that powerful, but the point is our body does this stuff automatically, which sounds good. But if you can see, if you can imagine all this stress in our body, that perhaps there might be, some downsides to this over time. So, because if your muscles tighten, it's like, oh, danger, every time you feel pain or every time you feel stress, and you're constantly in this kind of ramped up stage, could there be a downside to that? Could there be a downside to your heart beating faster, stronger, blood rushing? That hyper alert, it's kind of like you go up, and then what if you just kind of stay in this fight or flight mode? What happens to our body when the danger doesn't go away? What happens with chronic stress? And again, cognitive, emotional, physical, as Dr. Deming said, as I will very strongly say, is there even really a difference? Because stress, wherever the cause, all of our body is it's all combined. It's very interactive. And so when I talk about chronic stress, it's our system being amped up all the time. Those good fight or flight hormones, you keep them around long enough. Think about it. If our blood and our energy is going to our vital organs and it's going to our tummy or taking it away, people can have digestive issues. If you're on hyper alert, try sleeping through that. The more energy it sucks away to fight stress, how much is that, helping us protect ourselves against other biological intruders with respect to our immune system? And how does all that tension feel? It's going to affect our focus, our memory, our learning, because it's taken gas out of our tank. And again, what comes first doesn't really matter to me. Chronic pain can cause and trigger anxiety because it's a physiologically stressful reaction, if that makes sense. And not to mention the whole nervous Nelly worrying thing can create some of the knots in your stomach, sort of emotional, physical stress, because it's the same system. And that's a piece that I think is so important. Stress, regardless of the source, will change the way our brain cells, our neurons, communicate with each other. And it gets us in this amped up state, and then we just kind of stay amped up in this very vigilant and reactive and hyper alert sort of state. And I like this next slide because it shows literally what happens in different parts of the body when we keep this adrenaline, when we are in this hyper alert, kind of near constant fight or flight mode. Every part of our body is affected. Adrenaline sounds great, but our heart beating faster and stronger all the time, that puts wear and tear in our cardiovascular system. It's also tension in the body. There's a lot of stuff that goes on, and that's just stress, never mind the physical assault from an illness or the side effects of the treatment for that illness alone. And it creates this sort of chronic sort of thing. So what can you do? I would argue that there's a lot more that we can do. Because stress affects so many different parts of the body, we can attack or help better defend or push away stress in all of these different parts of the body too. It's about taking your control back, so to speak, in the ways that you can control. It would be great if you could wish cancer away, if you could wish stress away. Yeah, we can't do that, but there are things we can do. And so I've got, some areas here of ways that we people can take charge back of various things they do. I want to go through these and then let's have some more conversation about it. We can flip back to these. I can give you other examples, but my takeaway is we can do more than you think. And I can't think of anything more powerful when you're trying to find an illness over which you don't have as much control is, well, let's take the control back in the ways that we can. And so, like I said, I will go through these various things. Sleep, we're going to talk about that. Yes, if you're inpatient and you're getting woken up every 4 hours, that can derail your sleep. We can talk about strategies to better protect against that. Social connectedness, huge, huge, huge. Fun, exercise, but also learning to listen to your body more. Part of what you have to learn when you're fighting an illness is, I want to throw up, and let me try to not pay attention to that. But at the same time, our body does give us messages, and I'll talk a little bit about that too. The knot in our stomach, the racing heart rate, the headache, these other physiological signs of stress are our body's way of saying, yo, we're stressed, and learning how to harness some of that to help ourselves. Sometimes it's good old-fashioned psychotherapy, but not just lie on a couch and talk about your feelings kind of therapy. It's thinking very intentionally about what are some of the negative thoughts that might understandably creep up as we're dealing with various stressors, and what can we replace them with? It's maybe more adaptive, more positive. What are some of the behaviors we can change? My mom, I have many generations of breast cancer in my family, and my mom was raised in a bury your head in the sand school of problem solving, and we know that ignoring the emotional stuff doesn't help. I tell people feelings are burps. They're coming up. And so owning and taking head on some of the icky emotional stuff, that's how we get it out of our way rather than just burying your head back in the sand. So what can you do?
Dr. Shapiro,
Yes.
so I'm going to interrupt for a second. So
Yeah.
Could you go back one slide to that list? So why don't you have Valium, alcohol, and cigarettes on the list as things we can do?
Well, first of all, I can't prescribe. So there you go.
Okay.
And I would never say never to a really good Scotch whiskey. Old Bond Little Bay would be my personal favorite. Those are also biochemical things, but they are not health promoting. I think they're quick and easy, cheap shots, but they are going to treat the symptoms and not get at some of the root causes. Was that the right answer, by the way?
That sounds good. Thanks.
Yeah. Yeah. I do like my whiskey, but yeah, I mean, people, will self-medicate in lots of ways. They don't make the problem go away. Valium can take the edge off. Alcohol, I do like my whiskey, don't get me wrong. And smoking, yeah, I used to do that, and I hear it causes cancer, but those are not going to fix the problem. It's like putting a Band-Aid on a wound that really needs stitches. And I want to stitch the wounds and make folks more robust, better protective, and again, take charge, not just Band-Aid over it. Of course, those things are easier. This is not, but sleep is not as hard as it sounds. I was telling Dr. Deming, I have taken a real deep dive into behavioral sleep medicine because in my decades of work, I don't think you need a doctorate to realize we're a pretty sleep deprived culture. And you take someone going through any sort of assault, like an illness or an injury, I'll show you a great way to derail sleep, no matter how good it used to be before. But I hear a lot of mistaken things like, well, of course I'm not sleeping. I'm getting woken up and getting poked all the time. Or of course I'm not sleeping, I have pain. Or of course I'm not sleeping, it's COVID, insert here. They do not have to automatically create insomnia. Yes, things that happen to us or within us can certainly derail sleep. But sleep ain't rocket science, at least from what I've learned. There are good basic biological sleep drives. There are good behavioral habits. If I told somebody a half hour ago, if I do my job well, you're going to know what I'm going to recommend before I even tell you, through education. Behavioral sleep medicine, people like me, can teach you about the science of sleep and about behaviors that can make or break healthy sleep habits. And so especially if folks, again, are having physical symptoms that are disrupting sleep, and maybe they weren't the greatest sleepers in the first place, there are things we can do to reverse that. There's no excuse you could give me, my sleep is bad, because then I'm probably going to accept and say there's nothing you can do. I'm also very stubborn. The social piece, to me, is without question. And again, it is strong bias here. It's over 30 years of involvement with recreational camp programs. Camp Sunshine in Atlanta provides year-round programming for children with cancer and their families. I also worked with the Ulman Fund in Washington, D.C., Ulman Cancer Fund for Young Adults, which is primarily, they do a number of things, but they really preach hope and advocacy through sport. I was a Cancer to 5K coach. Social stuff, fun is huge. And I don't care if you're an introvert or not just because we say so, but there's such strong evidence that shows social connectedness is powerful. There's also the happy hormones, the endorphins, the good stuff that is released when we do fun things. People will say, well, I feel like crap, I don't want to have fun. I don't care. Fake it till you make it actually works. Because if you have to act like you care, if you have to pretend to laugh, if you do it often enough, it can change how you feel. But we also know, after decades after my mom's generation of bury your head in the sand school, that there's too much good research that shows that we have better medical outcomes for folks that have social support, whether it's your family, whether it's your family by choice, whether it's through your treatment center or the phenomenal programs that Beyond Cancer offers. It matters. And fun is also good. When I go to camp, kids might talk about cancer when they're lying in their bunks at night or getting dirty. I bring foam swords and they hurt each other. Kids are kids and fun is fun. And it is powerful. I was at a teen retreat online last weekend, and one of our campers said, yeah, God, I love camp because you're finally with people that get it, that just don't look at you and think pity. There is something really powerful about social support, not to mention good old-fashioned laughing fun, or just those connections. And you don't need a prescription for that. And it's even cheaper than cigarettes, Valium, and alcohol. Exercise is important too. It actually decreases our stress hormones. Again, this is all neuroscience. It's all biochemical. Exercise actually creates these feel-good chemicals. The Ulman Cancer Fund for Young Adults, now the Ulman Foundation, one of the programs that I most loved was their Cancer to 5K training. And their patient navigators would go into hospitals and say, hey, you want to run a 5K? Not, are you going to survive? But hey, let's equip you and prepare you. And there's something powerful about taking your life back, about getting physical conditioning, not to mention the tremendous mind-body healing supportive aspect of running. And You don't have to run. You can walk. You can keep it social. There are physical therapists, I would imagine, I'm quite sure at Mercy, certainly through Unity Point, that will work with patients who have that fatigue, that maybe have joint pain, or they've just become slugs because their bodies have been beaten up by cancer treatments. It is powerful and it is important, and I think it's great. Whoops, I went backwards. Sorry about that. I talk about mind body, and I could go to town on biofeedback. It's literally, if you think about our body and the feelings of stress, the racing heart, the stomach ache, headaches, what have you, those are our body's amped up signals saying, yo, there's a problem, slow down. And a couple of ways that we can control that without prescribed or over-the-counter or freely available substances. I'm going to be dreaming now of Valium and alcohol and smoking, but is through breathing. Breathing actually affects our heart rate. If we breathe in, our heart rate speeds up. If we breathe out, our heart rate slows down. You can read, and it's pretty basic. It's why people say, dude, just take a breath, just relax. Slow, relaxed breathing creates a slow and smooth heart rate. And so that's why you have the Calm app, and you have Headspace, and you have all these apps that teach you how to breathe. The problem I have with those, besides the fact that I have yet to find an app that doesn't use a voice I find irritating, is that it doesn't give you any feedback about how well you're doing. And I'll show you, so for example, I demonstrate to folks here a biofeedback software. It's hard for me to describe, but it's called Alive. It's kind of cool. And if you can see here, you've got all kinds of displays. We have the blue lines up and down give people like a pacer to kind of breathe in, breathe out. These little orange squiggles are heart rate smoothness from one beat to the next. And this little bar here that goes from red to green is how jaggedy our heart rate variability is, or how smooth it is. And what's cool is it's all based on your standard, heart rate sensor, whether it's on your ear, whether it's on your fingertip. And what's cool is it gives you feedback. So I'll be sitting here with a patient, say they'll stick it on their finger, and they might watch, for example, this kind of display. It's kind of cool, funky dots. And the smoother your heart rate, the smoother one beat to the next, the prettier and more dynamic the shape, the more vibrant the music that goes with it. So you not only get to see something, you hear something, you get all this visual feedback on how you're doing. And what's really fascinating, and teenagers hate this, of course, is they're like, I'm fine, see, I could do this. And then I might just happen to bring up potentially provocative or stressful subjects, and whoosh, you see it go down. We are so much more reactive to stressors that, especially when you've been in a state of constant stress, we don't notice the subtle stuff. We're only noticing the loud stuff. Our bodies had to get loud, or they got loud. And so what I love about this is that it gives you feedback, and it's just a piece of how you can control it. And there's all kinds of shapes. My favorite is the beach, where if you're breathing smoothly, you hear the waves and you see the trees blow. You can upload your own music. I would personally put Aerosmith at the beach and I'd be happy. There's video game-like things, but the point is it gives you feedback about how well you may be controlling your body and your body's stress reaction. And I think that's powerful. And there are, of course, other ways that you can do this through, mindfulness, meditation, progressive muscle relaxation. These all help with pain and mood because they are all different gateways to try to calm down a little bit of that hyped up, hyper alert, constantly in fight or flight mode system. Progressive muscle relaxation is literally a series of exercises where you tighten, because if I said, relax your hand, put your hand on the table, relax, whatever. If I tell you to squeeze about 10 seconds as hard as you can, and then on the table, you just kind of breathe out and relax. Most people, not necessarily a speaker doing this with their hand in midair, most people are going to feel that relaxation more intentionally. And if you do this from head to toe, progressively tightening, relaxing muscles, it literally introduces physiological relaxation. Probably not as much as Valium, but just a little bit. And so if you combine muscle relaxation and biofeedback and happy hormones, you can see where all these little ways a sense to deactivate, and that is how you can manage stress and kind of harness the support that you can get of these mind-body principles or mind-body relationships. social support, and then of course, as I talked about, individual or family psychosocial support. Cancer doesn't just happen to a patient, it happens to families, and it happens to friend circles, and helping everyone to adjust in whatever way is appropriate for that family or that group or that couple, whomever. And again, as I had talked about before, is our head in the right place, so to speak? Are there dark places or dysfunctional thoughts that we have that are driving our feelings, or that we've generated on our own because of this icky, hyped up stress stuff? Those are all things to think about, to take care of. And then of course, neuropsych testing. So my point is, there's lots of gateways. If you think about stress as a long hallway, there's lots of doors, there's lots of ways to get there. And they don't all have to be about pills and prescribing things, but some awareness of this mind-body system and good old-fashioned brain behavior relationships, to me, is really the gateway to manage the stuff. So that is where I'll stop. So
awesome. So tell you what, why don't you take your screen, stop sharing the screen, and
I'm
then
going to try to do that, yes, if my mouse will cooperate.
Your head and my head will get bigger. Here we go. So now I'm going to go to the gallery view, and you and I are both here. So a quick question, because I was going to interrupt, but then the talk was over. So I loved seeing what that biofeedback program Alive can do. And I saw there were 2 gizmos. So one was probably doing your heart rate. Was the other like sensing sweat, or?
I actually have one of those. So this is literally the heart rate sensor.
Okay.
So it's got this thing. And then we have another thingy. Thingy would be my technical term, but we can't clean it very well. It's a nice little Velcro thing. You can actually,
is it temperature or sweat?
You can do things with sweat and temperature. That with literally stuff like this, which is a little more sensitive and reactive.
Mm-hmm.
And I will be playing with that more. But what I love about the biofeedback is that it gives people something to do rather than just breathe and stare at the wall, which I have no patience for,
Mm-hmm.
and those voices are annoying. It's kind of cool to sit there and bend a spoon, or to land an alien space shuttle, or to drive a car in the desert that, oops, kind of accidentally falls off the track, and it's all through your breathing.
So the specific question I have is, I'm aware of at least one product is called Muse, M-U-S-E, and it is a biofeedback, but it's for meditation, and it just goes over your head. It's kind of like earphones, except the earphones are on your temples rather than in your ears. And
I'm Googling this.
It's
the brain sensing headband.
Yeah. So it's a way of giving you feedback on how you're doing with your meditation. And my question is, the sweat and the heart rate. I've done a heart rate one, and you're not really knowing exactly how it works, but your body sort of intuitively, by watching the screen, figures out what it is you need to do to bring down your heart rate and your breathing. And I'm wondering whether you're aware of any trials looking at whether specific biofeedback without instructions on meditation, is that more effective, equally effective, or it depends on the person to doing that sort of biofeedback meditation?
That's a great question. Well, I will say, for starters, I should send you this reference. I don't know if I'm reversed or not, because it looks backwards in my biofeedback and mindfulness in everyday life. There's a more technical version of this book, and I can send you all the link for it, that has some guidance. I'm kind of skimming it. I think some of it, it's where is your end game and how to relax. I have a nephew that is very into mindfulness and meditation. I'm sorry, give me Steven Tyler really loud in my bike, and that is mindfulness for me. The taking the flowers and the leaves, I'm supposed to like it, but I don't really like it. And so I think that everyone kind of has their own thing. That headband and sensor, it's also, I saw $349 when I Googled it. This particular software package is $219 plus shipping and handling, and lots of people can use it. And so I probably should know this, I guess, but whether mindfulness versus biofeedback works better, I don't know if we have really good conclusive data. I think some of it's just got to be personal preference. I do know that, and so one of the things that Kazan talks about in her book are some informal trials that people can do, maybe not this or the other version, but to see what they like best. And so in the context of my office, I show people the software, and the particular vendor that I got it from is an old techie guy who just thinks it's really cool. So he answers lots of questions. I have videos. I can send links to YouTube videos that demonstrate it. I like it because it's active. You do something. You get a few $100s and get arcade games. And so it's kind of fun.
Yeah. And do you think that most people that use it then develop the office, and I'm on a stressful phone call that leaves me and I don't have my Alive gizmo. Do you think using Alive, you kind of then get a sense for what you need to do, even if you don't have the biofeedback?
Absolutely. I mean, we are trainable creatures. And we are good at acquiring habits. That's like behavioral sleep medicine works. And so this is no different. We go to our recommendation with biofeedback is sort of a few minutes a day, a few times a week. Work on. So what are the odds of you being able to default to that when you practice it on an ongoing basis? I'm going to recommend it. I want people to try it. And the recommendation for the software, by the way, came to me from a colleague that has used it in pain clinics in Atlanta, now at Vanderbilt, with pediatric teens and some young adults. And so we know that this stuff works. It's how I dabble. But my daughter has found that she's doing 10, 20 minutes. She's in college, and that the idea is that first of all, you kind of take the edge off your system in general, but then it is a quicker go-to, as you said, because you can kind of close your eyes and visualize the swirly shapes. You can hear the music in your ear if you need those triggers. And I think that's really, really powerful stuff that people can use anywhere. I had a patient say to me, is this what that had some sort of recent orthopedic thing? And they told him before he was moving a gurney to bed to take a breath in, and then as they lifted him to exhale, and he's like, oh my God, this is why, because of that little bitty relaxation response. And so mindfulness is a way to clear the head of clutter and other things that's really powerful for some people. And I recommend it. I'm not an expert. I want to add to my tools. I also personally doesn't work for me, but I also like data. And that's why I like biofeedback. People can literally see their progress. And so heart rate is one measure, but it's, there's more and more research about heart rate variability, the smoothness from one beat to the next. You mentioned skin conductance and the propensity to sweat. That tends to give you a more immediate reaction, but that particular gizmo is $150. Most people aren't going to do that at home. So I want to show people how it works in my office once I've dug more into the research. But I think for your most home users, this is what we have at home.
Okay. The book you held up had in the title Biofeedback, but then it also had mindfulness in everyday life. Do you have experience or have any comments on John Kabat-Zinn's program, which is mindfulness-based stress reduction? And
I'm going to write down that name. What is it?
John Kabat-Zinn, Z-I-N-N. And he has trademarked his mindfulness training. It's 8 weeks or 12 weeks, I can't remember which, and it's called MBSR, Mindfulness-Based Stress Reduction. So it is one of the more evidence-based ways of teaching mindfulness that have in terms of, then being able to use that as a default. You get in a stressful situation, you've got some go-to tools that can help.
I'm not, and thank you. getting more into biofeedback and relaxation stuff, you know, my career continues to evolve. Coming here to Iowa, my focus was primarily sports concussion, neuropsychology, by getting to sleep. And you may have heard sports have been a bit of a lull lately, but also being literally housed in sports medicine and seeing so many patients with chronic pain and other things, and my trying to look for more and more tools. So clearly there's a lot that I don't know about this. There are folks that do nothing but mindfulness and neuro and biofeedback that I don't know. So I dabble, but this I think is huge. And I was just going to say that I think that probably what matters most, Dr. Deming, is that people find something that seems to fit for them. That I am a really sarcastic participant in yoga classes. I believe there's a teacher someday that will be a good fit for me, but it hasn't worked for me. People I know swear by mindfulness, and that is powerful and important. Mm-hmm. I like this. So I think that they're all different gateways with the intention of taking a little more of an active control, relaxing our mind, our body with intentional thoughts and behaviors. And that's really the most important thing. And yes, this software might look better in research or that particular approach, but if someone is showing that his package and the way it's taught and executed is effective, I take that at face value. And I think that is something's better than nothing. And some people might like it all. But if you're like, I've tried it, I don't like it, that's fair. We find something else.
You know, before your presentation, we chatted a little bit, and you talked about the importance of sleep, and I think I heard you say that so many of the patients that you see really poor sleep habits or poor sleep or lack of sleep contributes to so many problems. So my specific question is to invite you to talk more about that, but then also, are there biofeedback gizmos that have been shown to be helpful for those of us who have difficulty sleeping and we're laying in bed? And is there any biofeedback gizmo that can help?
Nope. So the short answer is, so when I could talk for an hour just on sleep. You really poked the bear here, didn't you? There are biological drives that govern sleep, but there's also good old-fashioned behavioral principles that govern sleep and lots of things that can interrupt it. And we all have various risk factors for, it's a shorter walk off a shorter pier for some of us. The short answer is it's not just, if your mind's tossing and turning, you're sorting all kinds of things, that's not a good thing. And yes, things to help you wind down helps. That's why you can't go from homework and little screens to boom, fall asleep, because we need to deactivate our brains. But it really comes down to, among other things, good old-fashioned behavioral psychology. Those, you ever find yourself so busy and so preoccupied that you get in the car to go home, the route you take every day, next thing you know, you're there and you're not sure how you got there? Sleep can be the same way. So the question is, I'll ask a lot of folks is, what % of the time that you spend in bed are you sleeping? And my goal is to get folks 90 to 95% or higher. Because if you are tossing and turning in bed and you're spending less than that, you're starting to train your body. The bed is for, it's for worrying. It's for Netflix. It's for tossing and turning. It's for all kinds of things. And so, yes, biofeedback, mindfulness, that can help kind of shut down our brains before we go to bed. But it's really behavioral psychology that is going to help people with sleep. The American Academy of Physicians' #1 recommendation for insomnia is cognitive behavior therapy for insomnia. It's behavioral. And it's cool because it works without a pill or anything else. And yes, there is a mindfulness biofeedback piece to the preparation for sleep, but I thought you were asking about technology for monitoring because they're all wrong. But you can train the body to go back to sleep. We wake up routinely a bunch of times at night as we go through various stages of sleep during the night. And so if you get woken up for a needle stick or for whatever, if your habits are righteous, you ought to be able to fall back asleep if they were really solid before that experience. But if they weren't, or it made you uncomfortable and you tossed and turned and you couldn't go back to sleep, and you start to kind of, the wheels come off the bus because you're training your body to think, wait a minute, is bed for sleep or is it for tossing and turning? And then if you don't feel good, and so the bed becomes where you are also reclining during the day or taking in visitors, your body starts to get really confused. What the heck is this bed for? And so that's where the behavioral stuff comes in, is retraining the body, but also figuring out how much sleep does that person need, what are their natural tendencies and stuff like that. But that long answer to a short question.
Great. Another situation that many of my patients talk about, and especially survivors, no matter how long you've been a survivor, is what they refer to as scanxiety. So, they're getting their every 6-month scan, or they're getting their once a year scan. And, for most of the year, after a certain amount of time, it's not an every second, every minute, every hour thing that they think about their cancer. But as soon as they get their scan, until they get the results of the scan, there is this anxiety. Are there, other than the tools you've already talked about, what would you say would be recommendations if you were to talk to somebody who pretty well has it all together, but the scans, that episode of getting a scan from about 3 days before their scan until they get the results, that they are super stressed? Does that make you think of anything in particular that might be helpful in that setting?
The first thing I think about is, well, duh, of course they're stressed. I think we as a culture, I think, tend to pathologize variations. And I think, in behavior. And, I see some folks who I'm like, of course you're stressed. If you weren't bothered by this, I think you were a psychopath. And so I think that for someone who is still in the middle of or survived a cancer journey, there's a certain amount of that is normal, but it still can be debilitating or disabling to varying degrees. And so I think that all of those skills are helpful. And it's preparing for like game day. If you've ever been on a team sport, you're preparing for the game day. You want to make sure your uniform is washed, your cleats, you've got tight laces. My bike before a triathlon is going to be spotless and clean. It's game day readiness. And so, for some people, it's writing down their worry log. When I have folks that are tossing and turning before bedtime, before they start their wind down time, I give them worry time, where you brainstorm on one side of a piece of paper all your worries, just kind of that verbal vomit, all their worries, and then the action plan or the counterpoints to try to diffuse some of that. Maybe that's when you take vacation days to do something fun to distract you. And it may be that you have a few sleepless nights, but again, if the better prepared you are, the more well-rested you are, the better tools in your toolbox for managing stress, I think the less disabling that is, and the more confidence you can have, like, yeah, next week's going to suck, but boy, next week's going to be great. And that optimism, because I think some of that is normalizing. Does that help kind of address?
Yeah, it does. I always like to think of things that people can do rather than just sort of, you're right, reframing your thoughts. So let me throw out one. You mentioned that you work with athletes. So some athletes, they have lucky charms. This pair of socks. I wear this pair of socks. Is there benefit to having lucky charm sort of things, whether it's the jersey or how you lay the clothes out the night before, which pair of socks you wear? Do people find those of benefit in preparing, reducing stress as they get ready for the big game? And are any of those tricks of the trade you use with athletes applicable to scanxiety, a patient getting ready to go to have their scan?
I mean, again, I get a good sports psychologist that focuses on that stuff. Yeah, but I mean, during March Madness, my mom would wear the same Virginia shirt the whole week until we lost. I mean, some super, I always take Oscar, my little beanie baby, to camp with me because, it's my good luck for my daughter. I think we all have that. And what's ironic is I'm talking to you and I'm looking at this camera. Behind you is my last cabin photo with my boys from camp that I'm looking at, so there's a reason why I'm looking at that while I'm looking at my monitor, so it's whether or not, again, is it so idiosyncratic and so anxiety provoking, the idea not to have it. There's a point of all good things where it like sends you into hyper mode. Then we start talking about OCD, the patient that has to have everything just right. And if it's the least bit, but why not? Because why not have a good luck charm? Why not? I mean, that's why we keep stuff, right? Because we have stuff that is meaningful. All the toys you see behind me are either given to me or they have meaning and they bring me comfort, not to mention distract patients. So why not? And why wouldn't preparation for scanxiety or that hospital trip be any different? I got any surgery I've had, I get new pajama shorts. I mean, it's good in some way. And if it's not, we don't have to contort ourselves or spend exorbitant amounts of money. If it makes us better, who cares?
As we wrap it up, you talked about your center, but you obviously have a history of doing lots of things with not only cancer patients, but all sorts of different. So if somebody in the audience is wondering, gosh, I don't even know how I would ever get referred to or see a neuropsychologist. So number one, are you available for consultations? And number two, if you're not, or what would be the in an hour with someone learning biofeedback and learning some of this? What's the proper way for someone to get connected to a neuropsychologist?
Great question. And if I could clone myself or didn't have to work for money, I would say call me anytime. So at Unity Point in Des Moines, there's me and there's me. At Mercy in Des Moines, you have two fabulous neuropsychologists, Sarah Tarter and David Paul, that have joined Neurology, I think. There's Brent Seaton in someplace in Iowa. I don't know where it is. And there's a few of us floating around this area. I see some folks from Blake. I have a hard time saying no to a cancer. I said I'd find a way to do it, even if my athletic trainer out there might say, why did you do that? It is hard. There aren't as many of us in Iowa coming from the East Coast. It's like, holy wow, there aren't that many of us. I think that, if you are interested in this sort of stuff, biofeedback, stress management, if you look for cognitive behavioral therapists. So typically doctoral level psychologists, could be some licensed mental health counselors or social workers, though they tend to not always get that level of training. But cognitive behavior therapists, they get the whole, thoughts and behaviors and making those connections. Those are people that may be more likely. Health psychologists in general will have training in that kind of stuff. So those are other options. Not many neuropsychs, because the traditional role is testing, they're not going to necessarily know as much about cancer. So I'm kind of strange that way, or some of these other things, but those are other kinds of people. And yeah, you could reach out to Chris, who I'm sure could connect you with me or to yourself. And if for someone that's in another part of the state, you can go to the National Academy of Neuropsychology might have Find a Neuropsych. The Iowa Psychological Association for folks in Iowa has a member directory, or you reach out to Chris, who
and the other thing, and we'll do some
fantastic. My pleasure. Thanks for having me. This is
us off. Chris, are you there? There he
I'm
is.
having a bit of technical difficulties on my end. I apologize for that. So, as Dr. Deming probably told you, these are all recorded and are on our YouTube page. They are also on the Mercy Cancer Center page. And if you can just search for Cancer Education Series, you can see the whole lot of them. And we hope that you enjoyed tonight's program, and we look forward to seeing you again next week.